have now seen an outbreak in and among the homeless community. Now, we understand that with what is going on out there with these spikes, we know that it would have actually caught up to us at some point of time. And so the homeless catching it doesn't necessarily mean that they are to be segregated or to be looked at in any way, because the population in itself have contracted COVID one way or the next. So we just have seen the outbreak because of the spike in the amount of cases. Now, one thing that we can say is that the homeless is going forward to be tested, and that is a good thing as we identify and as we identify the issue that we're facing. We encourage them as much as possible to make sure that they are being tested and they are compliant. And as they are compliant, we are seeing, that's how we've been able to see the trend. The organization stand as their address, and also they can utilize our email addresses, and that is why we know why they're being positive cases. We are working along with the ministry. We are working along with our peer ministry as well, to make sure that we can put things in place as it relates to the cases that we are seeing. Now, once that the client has tested positive and we receive the results, we will notify them. Just let me clarify, the reason that we receive their results is because you can appreciate that the homeless do not have access to email, so they will not be able to receive their test any other way. So that is why we put our organization's email address, contact information, and address up to them, that when they go to the clinics, that they can, polyclinics rather, they can give the information over, and we will receive and notify them immediately. Because once we receive it, we actually know where most of them are, and we can go to their locations or whatever the case may be. We can tell them, make themselves ready to be able to be picked up. And that has been the process so far, that we have been getting them up off the streets and into one of the quarantine or isolation facilities once that the transportation picks them up. And that is what we've been doing for the last couple of days. But we are seeing that number increase. Today alone, we would have gotten about 6 to 7 positive cases that we would have seen come in. There are more that are getting tested, and as they get tested, we are seeing them. And so far, we have just around 20 persons that are positive within the homeless community, and there are some from within other places that we're getting called for. And so, as we get those information as they come in, we make sure that we reach out to them. What we've put in place and we will do today is make sure we increase in the sanitizing, in terms of giving them sanitizers so that they can carry with themselves, and we will replenish it as much as we can. And we will also make sure that we give them additional masks. We have been giving them masks periodically. Other feeders are out there giving them masks as well. So we are trying to help with this situation, and we are moving swiftly to put things in place so that they can be safe, and that the general public can also rest assured. But they do not have to be segregated